Hi, everyone. Welcome back. Today, we're joined again by Albert Marinez, the Chief Analytics Officer here at Intermountain Healthcare. Things have really changed over the last month since the last time we talked, and we wanted to discuss the impact that those changes have had in our system, our health system, and what we can expect going forward, especially as schools started to open back up. Welcome, Albert. Thanks for coming back. We really appreciate it.
Thanks, Amanda. It's great to be here.
So I want to talk about what's happened since the last time we met. We saw quite a bit of a spike in late June, early July, but things have kind of started to taper off in August and starting in September. But schools are starting to open back up. How are things going at Intermountain?
Yeah, well, things have really changed this past month, as you were just sharing. We've seen that drop in the number of COVID-19 cases, and our hospitals have also seen fewer COVID patients who need that advanced care. So although we've seen that drop in COVID-19 cases, we're really staying busy, Amanda, caring for non-COVID patients whose services, if you recall, were previously postponed. And I'm really excited to also be able to share that we've hired additional caregivers to support COVID-19 testing sites. We had a spike in wait times for testing that we were experiencing in conjunction with that increase in cases in late June and early July. And that has been reduced significantly as we've hired more caregivers to support that. And if that weren't enough, we also have support from New York City for the past 3 weeks. If you remember, Intermountain actually sent not one, but two teams to New York City during the height of their surge. And they have come here to give our own ICU nurses a very much needed break. They provide backup for advanced training as well. It's just great to have them here. So, overall, things are going really well right now. We know school is starting, flu season is around the corner. So we expect a potential increase in cases, but overall, I feel like we're really well prepared.
And with the New York team coming us going to New York, like you said, we now have that last team here. They came on Monday, I do believe, to Intermountain Medical Center, which is really great. And it's awesome to have them here during a time where we're able to have our caregivers kind of trained a little bit more on different tools and systems that we have. So it's been really great having the support from that team. So we really appreciate it. The other thing I really wanted to discuss with you is how our trends have been going. You typically share with us some graphs that you guys have created that kind of show how the state has been going since the very beginning of this pandemic. And like I mentioned at the beginning, we've kind of saw that decline start in June. So I'd love for you to walk us through those slides and kind of showcase what we've been doing for the last little bit.
Yeah, no, absolutely. I'd love to share. So if you remember, we like to be able to share how different changes in policy and the community impact our numbers. And so what you're seeing here is a graph that correlates to those different community impacts. And if you look in starting in late May, early June, we start seeing that rise in cases, which was really concerning. But there were several things that were put into place at that time. So we had the Mask Up Utah campaign. We implemented mask mandates. Many in Salt Lake City, many businesses required masks, and keeping socially distant was strongly encouraged. And so you just see these numbers start to decline rather dramatically once we started pushing on that. And it just made a lot of sense as we saw more individuals being aware of what was happening and taking real meaningful action. Additionally, the governor had announced a goal of bringing that 7-day rolling average case count down to under 400 by September 1, which was yesterday. And so it's been, we've had this combination of government, businesses, cities really taking ownership of this and moving forward. So Utah has rallied, and these actions, they are working. And so we've seen this flattening in the number of cases, which is really, really good news. And then if you kind of move forward, we see a couple of different factors that may contribute to increases in the future. And those are things that we're starting to monitor. So one might be we know schools and universities have opened up. And so we're going to be closely monitoring what the impact of those openings are and if we see an increase in cases there. We also know cold and flu season right around the corner, and that will likely have an impact on these type of respiratory illnesses and changes in social distancing behavior. So what we've really noticed is when we have social distancing that's in place combined with masks, it makes a huge difference, and we can see that that red line. We want to make sure we stay diligent on that. If that starts to let up, we'll likely see an increase in cases as well. Knowing that the colder season is around the corner, we'll likely be more indoors, and we know that this virus tends to be more more impactful indoors than when it's outdoors. And so we're watching that very closely. But at this point, we're feeling really good, and we hope that the trends will continue.
I think it's really important to note you talked about the fact that we're going to be moving inside as it gets colder, especially here in Utah with the snow. And I think it's very important to know that if you're going inside to these places, either a business place or a school, you really do need to keep wearing your mask. Even though it may seem like our numbers are going down, they're going down because of all those things you mentioned. So if we don't keep those up, we could see potentially that yellow line, right?
Yeah, that's right, Amanda. And none of us want to see that. Now, the good news is we know what we need to do, and we've already done it, and I expect that we'll continue doing it as we move forward. So I I'm really encouraged, and I feel really positive about the response that we've had as a state, and our community has really rallied. And although we know this is a very contagious virus when it's left unabated, that we know more today, and we have the tools as we're moving forward.
And as far as what you think the future holds here in Utah, I know you keep mentioning that we're moving into this colder season, but how do you think the state's going to be doing over the next coming months into the new year?
Yeah, great questions. Well, we're going to continue watching these numbers every single day, and we will adjust as needed. We have a phased approach, Amanda, and if you recall, I talked a little bit about that last time. But we got a phased approach with very specific steps to expand our capacity if we need to ensure that we can continue providing exceptional care for our non-COVID patients as well as our COVID patients. And we're going to continue that. We're going to continue working closely with government officials, with our health partners, and with local communities as we move forward. What we hope is that as we've seen recently in the last 3 or 4 weeks, we hope that we never have to get to that place where we've got to add additional capacity, but we're prepared to if we need to, and we're prepared to do it safely as well. I think it's really important for us to always remember that a healthy community is really the key to a healthy economic recovery. So as long as we keep doing what we've been doing, keep socially distanced, wear those masks in public, wash your hands, we're on our way to a fantastic economic recovery as we move forward.
Another quick question for you too, as far as the data goes, with schools opening a week or so ago and some going back after Labor Day, if something does happen, what's the timeline of when we could potentially see a spike or a decline? Is there a period of time you guys look at to say, okay, in 4 weeks, 5 weeks, this is related to schools opening? What's the timeline typically you look at?
That's a really good question. So typically, when we have a change in policy or in behaviors, it takes about 10 days for us to see an impact in our hospital census. And so we are inside that 10-day period right now. Those numbers have still shown a really positive trend, but we also know that the trends that we're seeing right now when it comes to our hospital census, that's a lagging indicator. That is based on what we did 10 days ago or close to 2 weeks ago. So it'll be really important as we're moving forward that we are monitoring that very carefully. We also, Amanda, we look at other states and other cities as well across the country that may be ahead of us on school openings or on different policies to see if there's an impact there. So we're monitoring that very closely as we create our own projections in Utah.
That's really good to know. And it seems like we're doing okay so far. I know there's been a couple of cases of schools having to switch to remote for a few weeks to kind of figure things out, but that was expected. I don't think that was something that we weren't thinking was going to happen. So as long as people keep up the social distancing, wearing a mask, and making sure you really get tested if you need to, I think that's super important. Our testing has gone down, but our capacity hasn't. So if you're feeling sick or overwhelmed and want to get tested, you definitely can, which I think is really important. So, Albert, is there any last words you want to give to the community about what's been happening in the last month and kind of the data that you've seen?
Yeah, the last thing I would say, Amanda, is just we need to keep doing what we're doing and not be relaxed. It's easy, I think, to take things for granted that we're in a better place, but it's still out there. It's not gone. We want to stay diligent every step of the way, and we'll get through this together.
Well, Albert, thank you so much for joining us. And the phone number for you guys to call our COVID-19 hotline is 844-442-5224. You can get screened on that phone call and then show up to one of our clinics and testing sites and get tested for COVID-19 that way. We also still have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Albert, thank you again for joining us, and we'll talk to you next month.
Great. Thanks, Amanda.